like more access to it means more prevention.
Cassidy's calling. Hey, Cassidy, it's Steve.
Hi.
I put you on speaker, okay?
Okay.
And I think our yeah, we had some problems with it, but we had a question. We're talking about Narcan. And somebody remembered last meeting, you said that you can get that. Is there a cost for that?
Not, I mean, somewhere indirectly, but not directly, no.
But
Um,
what do you
we get
mean?
it through we get it through the state, and then we can offer it to anybody who would need it, like for themselves, or who might be in a position to help someone, or if a business or organization feels like it would be important for them to have. And then there's a different form for like law enforcement, and like public schools and things like that if they would want it.
Hey Cassidy, do you guys ever facilitate like training for using Narcan, or do you guys recommend? But it's specific.
Yeah, we have I think it's called general overdose education and naloxone distribution. So that if I would just bring it with me, sign a paper saying that they received the training, and then they would get the Narcan.
Cool.
What's the on, sorry, Dee.
Excuse me one second. Zoom should be working now, Cassidy, but go ahead.
Okay.
Go ahead.
So what is there ongoing training required, or once you've been trained, that's it for here to infinity?
Once you've been trained, you're only required to do the real train. Okay, hold on, I'll hang up and get on Zoom.
Okay, sounds
Yeah.
good. Thank you.
Yay, the internet's been restored. We don't have internet at our office either.
No.
Okay, so the initial training is the longer one, and it's about 30 to 45 minutes. And then after that, they ask that we just do refreshers, or if like we get new guidance from the state, we would send that out and make sure that everyone is like up to date on the information that we have.
Thank you.
Mhm.
So just to recap, because you sound much better on Zoom than my phone. It sounds like you can provide Narcan for schools and law enforcement and other people too, correct?
So yeah, we can provide it to the general public. For schools and law enforcement, there's a different form that we fill out, and then IHHS will send it directly to them. So that when they use it or run out, they can just kind of keep getting replenished.
Shelf life? I'm just still curious about shelf life of the Narcan.
It's
Jennifer.
about 3 years.
It's not too bad.
Well,
But that's
Would
not
depend.
guaranteeing on what you get.
Yeah,
But I'm saying
yeah.
it's not 3 years.
Depends on the outdate. It's just like buying a gallon of milk.
Yeah.
You never know what lot you're gonna get with what expiration date.
The majority of the Narcan and Cloxato that we have in our office expires in 2026.
And it's the same for first responders and EMS providers. They fall into the law enforcement and school category, right?
Yes. However, there is another program through the state, so unless it's like voluntary and things like that, they get it through FR CARP.
Maybe the state needs to work on aligning their own processes instead of locally.
Yeah.
What?
We know that.
What? Do you have any idea, Cassidy, how many people you've trained in CETA's service area, just off the top of your head?
No, we've been offering this training for 3 years, so it's a lot. I don't know off the top of my head. And then our treatment for Matt Clinic also offers it to all of the clients that we see. So I don't know on the treatment side how many they have done.
Can you, and this is Chris from Public Health, can you tell I mean, I know what mat treatment is, but can you give like a 2-minute overview of what that is? So the rest of the folks in the room know what that is?
Yeah, so MAT is just medication assisted treatment. So somebody who has an opioid use disorder will come in. Most of our people go through the SOR grant, so it's free to them, and they will get methadone, which is an opioid oral medication, measured out by a nurse every day, and they take this small amount to help them taper off of whatever opioid they're on. And then the other side of MAT is the therapy side of it. So we have substance use counselors, and they are required to meet with the counselor. I'm not exactly sure, I think weekly, just to kind of try to address the physical aspects of a substance use disorder, and then the mental issues that it can cause, or, figure out why the substance use started in the first place. So it really addresses both sides of that.
Is there an age limit where an individual can begin? Do your people have to be 18 and older, or is there an age limit where anyone can access MAT treatment?
I'm not sure about every treatment facility. I believe CETA is 18 and older.
Yeah, that's what I thought, but I just wanted to clarify. Thank you for answering my questions.
Yep.
I got one more. I gather that you're with CETA. Is that
Yes.
right? Okay,
Yes.
so do you feel like, is your capacity kind of maxed out, or would you do well with more providers, more funding? What's the kind of demand for your services like?
As far as the treatment side of things go, I can't fully speak, but we are busy all the time. People are in and out constantly. As far as prevention efforts go, we've had a lot of turnover, and we've lost a lot of people in the last the last year really. So I think that I'm spread really thin because I cover 10 counties. So it's really difficult to be everywhere and try to get in with everyone. So if we had more people, we would obviously be able to do more. Treatment, really busy, does really well.
Right, thank you.
Yeah.
I mean, my eyes, I don't want to change the topic, but my eyes have been on the treatment section here in part one, and, thinking about, just as a case manager, I know, and I'm like, large part of what I do is refer families to services and resources in the county. And I just know from doing that things are pretty much at capacity, and I'd love to see more substance abuse rehab opportunity. I don't know if like Optimate could be at the table, for this conversation, and see where they're at with their capacity or what they can offer, if they could use a boost with funds, but I don't know. I'm a big fan of using funds to hire individuals that are dedicated to treatment and recovery. Like, that's a huge, I'm all for supporting the education piece because I'm there in the schools, but I would love to support, more sort of boots on the ground rehabilitation individuals serving our county, because I know it'd get used. Like, I could send the parents there.
I think the problem is just Sustainability and the
Sustainability.
funds, like if we could band together with other counties and all go in on something, I feel like that would be more possible or more feasible, but like funding that job, like another position full-time for, in perpetuity, I don't know if we have.
Is it not feasible? It sounded like it was, I mean.
We've got today $206,445.
Right, and and that's until 2030 or something, and if you pay somebody like 50 grand or something, like, I don't know, that's a piece of our funds, but not all of it, and they would just be like dedicated to this task full time.
Cassidy,
Yes.
if some opioid funds were to be used to help supplement an employee, who would we have that conversation with?
I would probably start with the unit director, which is Suzette Van Bark. And I can always forward you her
I have her email.
information. That's who I would start with.
I mean, and from your aspect, at least as a start, would it be able to designate somebody for Jefferson County? At least part of the time?
I I can't answer that because I don't know
Yeah.
which person covers
Understandable.
which counties. For
Quick
sure.
question, kind of along the same lines. Do you currently have open positions that you can't fill because you don't have the human resources? Or are you not hiring because, I mean, are there no job postings out there?
Last I knew, we definitely had postings, still for the treatment side. Again, we lose, substance use counselors pretty frequently. And I know we also have another opening for an LMHC. On the treatment side of things, I don't think we have a full-time position open right now. There might be a part-time. We just had one employee step down to part-time, kind of like phasing out to his retirement.
Cause I mean, I know for me, like I would love to hire more nurses, but I have an opening that's been open for a year and a half, like,
Yeah.
like,
I'll-
huh?
The
Yeah,
There's
Not-
3 night shift.
yeah.
It's like people just, I don't know.
Yeah, so I mean, the reality is you can throw money at that all you want, but if there aren't the individuals that are willing to come and work in rural Southeast Iowa, then you know what I mean? Like, you have to think about that too. Like, if the human resources aren't there,
Right.
then
Yeah, I mean, that's an
Yeah.
issue across all
Correct.
service industry for sure. Maybe we change the thinking to how do we like provide scholarships or training, to build up that employment base,
right.
well, that'd be pretty neat.
What
And
other treatment programs are available to Southeast Iowa?
Is there a methadone clinic in Atumwa?
Yeah, that's what she's talking. They have one at CETA, Matt, yeah.
Okay, I didn't even know that.
Yep, has been for several years.
And they're full.
I don't know if they're full per se, but,
Well, you have
you
people
have
phase
people
in,
that
right?
phase,
So
yeah,
like,
they come
and-
in and come out.
please, inject here because you're obviously more of an expert, but typically those patients are going in daily.
Mhm.
And then after they meet certain milestones, then they decrease and they don't go in daily to get their meds. They go in, whatever, every other day. And then so once that person is
Yeah.
phasing out, then,
Taper
you
on.
have potentially opportunity for others to, join the program. I think some of the, I haven't done a ton of research on it, but I think some of the initial restrictions to offering like Suboxone and methadone for providers has loosened a little bit. So it's not as stringent, but that's just some of the, hot topics I've read like over time.
Cassidy, there's also, is it ads in Burlington that has Matt as well?
yes.
Thank you.
Something that Chauncey just brought up too, via text was maybe like helping, because some people just can't get to treatment. So
Right.
providing transportation, something as simple as that, or, and I don't know if it would be possible to like designate a certain amount of funding to specific treatment centers to use for Jefferson County residents. I don't know if that would even be possible, but something along those lines too. If we can't, increase the number of treatment facilities, then increase availability for Jefferson County.
15 trains.
That would make that service more available.
Right.
for-
exactly.
15 transits on that.
Yeah, I was just sitting here thinking that maybe we could partner with
Yep.
transit on that.
Mhm.
That is one of the issues that we have with people just not because we have people from our Tim County area. And so we have people that have to travel fairly far every day if they're doing methadone, especially at the beginning. So if they are under the state opioid response grant to receive methadone, one of the incentives we do have are like gas cards and things like that. But transportation can be a barrier. Childcare can be a barrier. We've had parents have to bring their kids in, and that's obviously not ideal. So there are a lot of barriers that maybe there could be some solution with the funding to make it easier or more accessible to people. And I will say, I looked at the snapshot that Chris sent out, and from it said 66 people from Jefferson County were admitted for treatment, and that number is not accurate with what we have on file for treatment currently. We have 112 people from Jefferson County.
Yeah.
I just thought I would share that our number just for treatment is quite a bit bigger than that.
We talked about this before you hopped on, Cassidy. The data is just that. It's a point in time measurement, and once something's published, it's already
Right.
old, and you can't keep up.
Yes.
The state sure as a heck can't keep up with the data. You know, Lee did print this off and handed it to me, but I'll share this with the group because this was a question that Ken asked. 143 people died from opioid overdose in 1 year. Prescription opioids are a factor in 44.8% of opioid overdose deaths. Heroin is a factor in 25.9 deaths. 55.9% of deaths involve synthetic opioids. Opioids are a factor in 49.8 of all overdose deaths. 4.8 out of every 100,000 residents die from an opioid overdose. That's 67.1, below or less than half the national death rate. 0.29% of hospital births are causes of neonatal opioid withdrawal syndrome. And I was just thinking about that demographic, since we don't deliver babies at our hospital. That was where my mind went with this too. Doctors write enough prescriptions, and I don't like when they say doctors, they need to say providers, because that offends the NPs of the world and PAs. Doctors write enough prescriptions for 49.3% of residents to have one. 12,600 cases of hepatitis C are attributed to intravenous drug use, and the state does have a program to treat hepatitis C. 2,671 cases of HIV and AIDS are attributed to intravenous drug use. But those are just numbers, but that doesn't show the cost of Hep C or the cost of HIV,
Right.
or the cost associated with the fragile healthcare of these substance users. I mean, that's just thanks, Lee, for getting that data. But that's just a glimpse of it. That's just a portion of the problem. And then they end up with respiratory problems. They end up with TB. They end up homeless. They end up with all these other social determinants of health issues that fall back to the communities to try to lift them up and support, with very little funding to sustain programs. Sorry, I'm just calling it. I mean, I work in public health. This is the reality of things. And our community is not unique. It's very much across the board. It's just, we have 15,000 residents. Well, that's different than 215,000 residents, but your problems just exponentially rise.
That's why prevention is so key.
Right.
That
Once
reminds,
they go down the road, it's a life,
Yeah,
it's a
you
life,
can't get them
it's
back.
a life sentence.
But a
Yeah.
lot of times it starts with childhood trauma. So the users, whether it's mental health or substance use, it's just exponentially is carried forward. Sexual abuse, human trafficking, all of those things. I would like to see our community do a program on human trafficking. I attended one a few weeks ago at a conference in the Quad Cities, put on by an Illinois State Trooper. It's scary.
It's at the high school, like we have someone
Yep.
out there, she got pimped out,
Yeah,
and she liked it. She got money and got attention, and I was like.
yeah. I mean, these are the things that
"No,
go
let's not
on.
Lose someone, like a high schooler, cause wasn't fentanyl, like, getting laced, like, wasn't it super? However they make the opioid, there was like a bunch of fentanyl in it, so until we lose like a student, or like we've lost big people in the community to drugs, but it's like. Until like smacks us in the face, I think people just are like, I don't know.
So here's the issue is that, and I find this in so many of the meetings I go to, we can sit in a room and we can brainstorm all we want.
Yep.
That doesn't spend the money, that doesn't help anybody. I get like, we have X amount of years to spend this money, so we want to do it right. But the reality is what is right, right? And so to be fair, I would love for someone to make a list of the goals and figure out a timeline of to what, because we can sit and have this meeting all day long and every day long. It still doesn't fix the issue of getting the money into the people who need it.
Right.
So, whether you identify three places you want to move forward and work on it. But if we're not actively working on something, I can tell you that I wasn't at the last meeting, but like, unless I have a deadline to tick off, there are gonna be fires that burn in all of our worlds. every day, every hour sometimes, and unless there's a deadline, it's not ever gonna come to the top of the list.
And to piggyback on that, at the last meeting, I explained that at this training I went to, and then also at the last ISAC conference, which was in March, I believe, there was a speaker on this topic and some other counties and what they're doing, and everybody's in the same boat. You know, a lot of counties haven't done a lot yet. They're studying, but they really stress, do one thing, do it well, or supplement things that are already there. So I think that's what we all need to think about, and maybe, I agree, we need to hone down on, and I'm glad to see so many people, because we had a smaller group last time. The other thing is, the speaker at ISAC really suggested the overall goal of this money is to prevent deaths. So if we think of how do we prevent deaths from all of this, and what helps?
The reality is you're not going to.
Right,
Still gonna
but
be
if
a
you can
certain
save,
demographics of people that die from opioid use, so.
sure, but if we can think about how can we prevent any death, you know, it's obviously it's not gonna do everybody, but
Is there anything that we're doing now that's working well in the county?
Even like first responders for Packwood, like I've sat through training the last couple years, I'm like, I've never gotten Narcan training, so like that would be one thing to at least do Packwood QRS, because we had druggies all over rural areas, so that would be nice, but even then, I'm like, I've never done the training through JCHC or, so it'd be awesome to get that and get it, like, I know we have it in our first out bags, but the only thing I know is don't give it alone. Make sure you have someone beside you. That's the only thing that sticks out that, who's that lady that
Renee.
tells us that? Marty
Oh,
Chandler.
yeah.
Well, it sounds like Cassidy is, I mean, address that, and
Yeah.
it's not even gonna cost any money, like, we don't even need to use the opioid funds for supplies of Narcan and for the training. Other than that, it seems like everyone, at least at this meeting, has identified potentially education for parents and starting there with maybe like a tall cop or a speaker, but again, it's not clear that that's the best use of the money, so I don't know.
Well, I don't think you're ever gonna have a clear best use. Because you can't, there's not a 1 + 1 = 2.
he wants to,
Obviously work with Chris and work with Ken, and we've done this before and with, and actually for that matter with CETA, and we had programs and we did things. The Civic Center, we went into the schools. And one of the things that there isn't a day go by that these parents or these kids, the teachers, I mean, you cannot turn on the TV and not hear about opioids and all the deaths and the things that are caused from it. And I'm not wanting, I mean, I right there with you as far as wanting to save lives. And you know, maybe one, you know, if you save one life with an education program, then I guess it's well worth it. But we've been down that road 100,000 times and nothing ever changes in that regard. And so, I don't know, I clearly don't know what the answer is, and the professionals like you be talking about, you do it every day. But you can only beat somebody upside the head to shoulders so much, and if they don't get it, you know, and money's associated with it, I don't know if they get involved with it and start selling it, and it just, I don't know. All I know is that even if you made it mandatory at the school, that it was a mandatory assembly, and these kids had to attend this with their parents to be able to graduate. Okay, so they attend it so that they can graduate, and they walk out the door. Odds are, you haven't gained one foot on the end result. I don't know what the answer is, but I, you know, education sounds great. Years ago, we used to have, I can't even think of the name of it now, but the police officers used to come in DARE program. We've thrown money at this for, I can't tell you how many years, and it only gets worse. So
I think though, the expectation is, I think you have to be realistic in the expectation that, number one, you're never gonna get rid of all of it.
right,
You absolutely will not get rid of all of it.
No.
And the reality is, and that's a hard thing as a professional to see these people come through your door time and time and time again for the same thing over and over, and it makes you a little jaded sometimes. But the reality is, if you get 1 or 2 saves, what's a life worth? And no one can put a dollar amount on that, right? Like, I mean, we talk about this all the time. Like, yes, we've spent how much money on individuals in our system, whether it's state aid, state Medicaid or whatever. But the reality is, a life is a life, and there's not a dollar amount put on a life. So I agree with you, Ellie, because I can get jaded too. But the reality is you have to, and you're never gonna know. You're
No.
never gonna have that person come back, that one person come back to you and say, man, this is what caught me.
Right.
This is it. Like, so getting numbers that, like, that's the hard part about this. There's no quantifying it, right? Like, oh, I was doing drugs until I went to this, and then I decided not, then like my life changed and I didn't.
So you go back and I agree with you, but you go back to what you said early on about marijuana being different today than it was 30 or 40 or 50 years ago when I was growing up. And I have no doubt that that's 100% true. But then you've got state legislatures all over the country, including ours, talking about legalizing marijuana. And then it's, for medicinal purposes. And that's what you open that Pandora's box, and so that's where it goes. I don't know if the answer is to start at a very young age as opposed to
Grade
even middle schoolers or
Yeah.
grade schoolers.
Well, it seems like, first responder training, law enforcement seems to be like a priority, what I keep hearing over and over today anyway. And then again, the youth, whether it's a good choice, bad choice, a speaker, or it could be the treatment. Cassidy, you want to say something?
I just wanted to point out, data for treatment for youth in Iowa starts at age 10. So third, fourth, fifth, I'm not sure, 4th grade.
I'm gonna say you could talk to the middle school principals and find
Yeah.
out how many vapes they've taken in the last year, and you'll know that the middle school
Right.
is too late.
And
Yep.
I don't know if anyone was at the Drug Endangered Children's Conference in Ankeny a few weeks ago, but one of the alarming things that the head of poison control shared with us in Iowa is that calls involving THC have like tripled in the last like year and a half or so, from edibles and whatever else. Kids getting into their parents' stuff or older siblings' stuff, and then, having issues with technically overdosing on THC, even though it's not fatal, they have those other issues that come from it, get really sick, those kinds of things. And then the other thing I wanted to note, there's been a really large increase in the amount of calls regarding like teenage girls starting around 13 to 16 and opioid use. So like mental health, especially a big rise in teenage girls specifically, whether it's a suicide attempt or whatever, involving prescription opioids. That was another thing that she said is like a huge, huge increase.
I do know that my car is trying to facilitate my ascension, which is a story of, I can't remember her name, that
Oh, yeah.
attempted suicide.
Okay, good to know.
But
So-
I would like to request some of that some of this funding to help support that, because it's like $1,500, I think. But he's already working on it, and he's got some potential dates to show it at the theater here.
Chris, I think he's gonna show it over in May and I got it.
Oh, great then.
Okay.
Okay, we'll pass this
Regarding
around.
what you were saying, Stacy, so do we have a process, or can we build one to have things be moving forward and like, ratified by the group in like outside of working groups or something, so that we're not waiting on meetings, or, this group comes together bi-monthly perhaps
Right.
going forward.
What
and
would
in
you
the
recommend?
meantime- Well, I was thinking working groups. So if this group can at least identify whatever, show of hands majority, I don't know how we want to do it, but we like that idea, educational speaker. We like that idea, more training in Narcan. We like that idea. All in favor say aye. And then there's these groups like,
Sure.
who's moving that ball forward in the meantime? Go ahead and put a deadline on it. How do those working groups get the money ratified? Okay, you need a legit proposal together. You've shopped your options, whatever. can we submit it via email to the group and how do we, yeah, you just keep it moving. I don't know what our process wants to be.
Okay,
but-
There has to be a structure, right?
Yeah.
Yeah, so let's build that
Bylaws or-
structure.
I mean, I don't know that it has to be bylaws, but there needs to be some kind of written structure, I think.
A policy.
Or who are the
Policy procedure.
approving members? You know, who carries the
Well,
stamp that
the
makes
final approval is the Board of Supervisors, because that's how the state set it up.
Got it.
But obviously, we want community input and consensus, basically.
So again, Ken and I are working on the speaker series, so you've given, I mean, there's been lots of things talked about today, so, written notes too about things you would like to see. I think if somebody would take on the Narcan training, that would be great. Again, I'd like to go back to Ken's question of, what are the treatment options here besides CETA? Is that our best go-to? I mean, and to your point, Dee, do one thing or do it well, or support others that are doing it. I think if we try to do one thing and do it well, we'll just blow through this money and it'll be gone in 4 years, even though we got trickling coming in. Like, for example, hiring someone. Well, that money's not gonna last. So
It's not.
I think if we can find the things that are already existing that do well, and we can support those,
Right?
maybe that's,
So I don't.
to me, that's a little better use of funds.
Yeah, I don't, and I can't remember what her name is, Chris, I purposely am not good with names, but, and this has been a few years ago, but at the Optimate, I don't know if that's the right word for it, the resource center, there was a lot of,
Oh, yeah, when they have the resource house.
yeah, they did a lot of work with like ACEs scores, which is, a quiz that you can do that talks about childhood trauma and how to, sort of combat that. And then, I don't think that's a bad thing either. But I do think, interestingly enough, we get asked a lot at the hospital, like substance use. Actually, I got an email while I was here about someone requesting where do they go to get treatment for X. The problem is like an inpatient treatment is so expensive. And it's so hard to get into, and a lot of insurances don't cover it. There's not very many inpatient treatments, for substance use around, and they have to have certain, they have to have that substance abuse evaluation done before they can go. There's just a lot of pieces that for someone that's struggling is really hard to do. So I don't know if there would be a potential, like we were talking about with transportation, like even being able to set up or set aside like we did for mental health, Sandy, when we set up, the one appointment a day was held open. I'm not suggesting that we need one appointment a day for substance abuse, but is there a potential to have 2 a month? So if someone's struggling and they're trying to get in and get help, does it make sense to have 2 appointments held over to slot patients in? I don't know. And the other piece that we've talked about is, like potentially trying to find, again, with your speaker series, something that would relate to the medical community and offer CMEs for the physicians. These are good prescribing practices. These are,
CMEs, sorry, what is that?
oh, sorry, continuing
Continuing
education for physicians.
Yeah.
I assumed it. was
Yeah,
that, but
sorry,
couldn't get the acronym.
It's all right. We'll help you.
But, getting providers to something that would provide them with some medical education units would be beneficial.
Has there been anything done on that?
So there's a requirement when they renew their license that they have to have X amount of hours, but I don't know that there's ever been anything done locally
Okay.
for that purpose.
Years ago, we offered some CME, when we had to go through the university to get them. So it's a whole process, which can be done, but.
Right.
Cause they look at like those scores.
Morphine equivalents.
Yeah.
Yeah.
Cause the doctors were like growling about, this was before COVID, they were growling about it.
Yeah. So basically, any opioid prescription that's written has to be put through wow, I'm drawing a blank now. Basically a statewide system that says like this person is on these, opioids and benzos already. And then based on that score, they have so many morphine equivalents and there's a recommended morphine equivalent for the day. per day.
Is that what it's called?
What's that?
Is it PMP?
Yes, there you go, PMP, the provider medication, prescription medication program, or
Prescription monitoring program.
Yeah.
Yes, so, I mean, there's a lot of like nitty gritty that, unfortunately, it comes down to the providers and it's very difficult. Like, it is difficult, and so,
Do they get their education online or in person?
typically online, I think they would like maybe to do some more in-person stuff. Just from the things that I hear,
Okay.
but,
Okay, so to get back to your point, we've covered a lot of ground today. What are you hearing as the top 3, 4?
I think there are 4 that I have written down. Narcan training, which we've identified, Narcan supplies and training, which
Right.
we've identified as free through CETA, but it's just a matter of kind of facilitating that. Parent / like provider training. We talked about maybe having Tall Cop come in or some kind of education for parents just to know what to look for and know what's available out there for parents who needs less experience with weed was in the 70s or the 80s, Education in schools, one note there is that as we identified in a previous meeting, that has to go through the school board. So any kind of education series that we want to implement in schools would have to go there. And then treatment options, what is available, whether it's possible to kind of like set aside some funds to go to, like an appointment that's just for Jefferson County resident or, a bed. One other note that I put here was just our options for the jail and what those treatment options look like too, and maybe kind of like delving into those, and what would be appropriate there. So it seems like we've got kind of three subgroups. I mean, we identified 4 things. The Narcan training, though, is not something that I don't think need to allocate funding towards, but parent provider training, education in schools, treatment options.
And I don't know what ISU already has because they do a lot of education and programming and they're expanding. I mean, we always think of ISU as ag. I mean, that's a lot of what we think sometimes, but they do a ton of other training and education that's evidence-based or best practices.
Yeah.
Dee's giving me a finger to wait.
I'm looking up an email that I
It's an appropriate finger.
just received, but it's to
Yeah.
speak to.
Yeah.
So I went to the extension open house last week and asked Courtney, what's extension doing? And she
Yeah.
said, okay. There is.
They're always doing something. I can't keep.
Yeah, extension has some resources and I haven't had time to dwell into them, but, what's she have?
Do we want to identify who wants to be part of like which
Yeah.
working groups so that we can communicate outside of this meeting?
Okay.
to,
Yeah,
like,
if we all
who's
want to
doing?
approve those priorities and
Yeah.
then get
Everybody okay with, okay, to recap, Elizabeth?
Yeah, she did that.
Yeah, so I don't know if we need to identify a working group or subcommittee for the Narcan training.
What do you
we
think on that one?
That is,
I think there needs to be a liaison
okay.
for the county to
To
go
Cassidy.
between CETA,
Mm-hmm.
or at least ask the questions. I don't know if you think that's appropriate, Cassidy. But I think there needs to, like, I was just talking to Shelley, who normally does this at the hospital for the EMS responders. And she had just reached out and talked to someone, at CETA, and they said that they're not doing the Narcan anymore, which is why we were trying to figure that out. So if we could have a point person in, we would be happy to do that. Hospital, it makes probably more sense on that level.
So you could come up with somebody in that meeting?
Yeah,
Is that what you're saying?
yeah, I mean, just the hospital could be,
That can help with
Okay.
that,
and
yeah.
done, okay.
She
Okay.
put her down to help.
And so we can maybe communicate
Yeah.
that not only to the schools, but also to law enforcement too. We don't have anyone here from,
Gotcha.
representing law enforcement, but if they need training too.
Do you want to?
Yes.
You're sitting here talking about helping folks, I think it's great. But consider the young kids
Do they have the
need to be
Narcans?
addressed.
have supplies, I'm not sure about the training.
Yeah.
Because you can't wait till there's a problem. Let's try to take care of a few before that problem.
Yeah. Stacy and I said this for years, education needs to happen in preschool, grade school, and
That's
everybody looked at us and we're
Well-
like, no, we're like, yes, that was
Isn't
15
that
years
part of the
ago.
education?
I think so. I think that's what we identified and
I haven't
something
heard
that's
that.
more
Oh, that's who
general
Shelley talked
too,
to and
but
said
you know,
no.
whatever subcommittee that
Okay.
wants to take up
know.
that
So
section.
subcommittee would be,
Like parent and or provider training.
Yeah.
Parent and or provider training, education in schools,
Education
treatment.
Is that
treatment
all
options.
together?
Those are the three. We've got three.
So say the education side, I'll be on that working group. One thing that I can definitely commit to doing in the meantime is researching up like who are presenters that are doing assemblies and sort of large scale presentation of information, and then also like what programs exist that are more, duration based over weeks or months or something like that. I can research those up. Whoever else is in the committee, we can look at it and see which ones we like and think are strong, and then we could present that to the group. Here's what we think are the best options. This is what they cost. If the group likes it, then maybe we take it to the school board.
does anybody else want to be on the
So,
education?
well, why doesn't he work with Ken and I? Because that's kind of, that's
Yeah.
the vein that we're in.
Yeah, and you have the
So-
parent side idea,
Yeah,
which I
and-
like.
The
and,
parent
My
provider.
question is, if Talk Up is a year out, could we get approval to go ahead and book that? And,
That's what I was
And-
thinking.
I mean, too.
because I don't want it to be another 6 months and we still haven't booked him.
Right, yeah.
So, yeah, just, do you
But
know
you
how
know,
much he
because-
costs?
You still have your emails, you'll have to go back in.
Chris Rankin told me when I asked her, and this was like last October, it was 14,000
It's
to get him
about,
down there.
yeah, it's like
Yeah.
15.
For one day?
Yep.
I need to become tall cop. I'm pretty tall. What do you guys think? That's my new calling.
Well, and that's where it might
Wow.
behoove
Yeah,
us
it's
to
expensive.
reach out to some other counties, which
Wow. That's my new job. I'm gonna be traveling a lot, but you guys will see me.
And
around again.
organize, they could come here, go to.
He's
any
coming from
county, go to
Texas, so it's
wherever.
not like you can
There
fly
was a
from
guy
Texas for
that was
free.
at a
and-
nurse conference this summer that talked about fentanyl and his son overdosed, and that like hit me in the feels, cause I work with high schoolers, but I can look it up and
It
email.
just
Carlos
seems
and you
like Talk
guys.
Up was seen here by many people from this
Yeah.
group. And it was well received and everybody keeps pushing it. It's like 15,000 is a drop in the bucket of this $200,000 to bring him here.
Yeah.
That's my take on it.
Yeah, I'm all
I
for
say-
him. I
I
think
say
I'd like
let's
to
just
shop
get
around
him.
others too,
We
because
should make that available
they all
to
have YouTube videos
schools.
of them presenting. We can watch it and see what they're legitimately like.
But getting Talk
We
Up,
want to make that available to all the schools in this county.
I think that would speak to the parent provider training rather than the education in the schools. Because what we're talking about education in schools is young and more like generalized education about, I think, and.
Smart choices.
Yeah,
Making smart
exactly.
choices.
But it'll be dependent on, so Augustine, you're gonna head up to education in schools. And then Connie and Ken, are you guys doing parent provider training, looking at that, or are you guys working on education in schools?
I think we just-
Education period.
Yeah.
A lot of overlap there.
Anybody
Well,
else?
We could probably bundle it.
we've identified three different, or whatever.
And then the next one would be
Treatment?
Treatment.
treatment.
I would be interested in heading up that subcommittee or being involved in it, I guess.
I'll be involved in that too, because I'm already in touch with Optima and a lot of the providers, and I'd like to just help research what's our capacity and what's the sort of fulcrum, like how can we support what's already going on, what's needed? I'd like to try and answer that question.
We
at
need
least bring that
somebody from
back.
the Jail too.
That's why I
serves on
wanted
that.
to
Yeah.
liaise
Yeah.
with them and
Yeah.
make sure that we understood what kind of need they have in the
Yeah.
jail. I know they have CETA coming in, but I don't know
Mhm.
if they could,
Yeah,
you know.
just facilitating them to
Mhm.
rehab or whatever when they get out of jail and they're gonna go to treatment. That's a huge issue
What
of
treatments
itself.
are available besides CETA?
Well,
There's
in the
resources,
county
but-
or that you can be transported to, because there are others, like in Burlington, I know Burlington has a treatment option. There's like Hope House, which I believe is in Ottumwa. I'm not sure of all the other ones too.
Yeah, there's Southern Iowa Mental Health does some things, and then like there's an agency, there's like the halfway house, so it
Mhm,
depends.
right.
One size doesn't fit every person that needs to go to
Right.
treatment, so it's,
And-
and then they
and
gotta
for
have a
other-
bed.
and for
Nothing
other
on
medical
it.
issues, like if we were talking heart conditions, if you go in Iowa City, or if you, just because
My
it's
car
needed for people here, doesn't mean we have to access the provider here. If it
Right.
happens to be in, Cedar Rapids, then let's go to Cedar. How do we get them to Cedar Rapids? Because that's what we need to do.
Mhm.
We're not large enough to bring all these people here on a regular basis, but we can disperse out.
Is
Yeah,
anyone
but we
else?
need to understand, I mean, in my view, understand. I think where can we be most effective with those dollars? Where do most people go in our county as a first step, potentially?
See, and I'm not looking
Yeah.
at it as dollars. I'm looking
I'm
at
not
it,
either.
I'm not looking at it from a dollar standpoint. I'm looking at it from my public health hat of all these things need to be in everybody's
And then
community
figure the money.
or access to it and then figure out
And
the
then
money.
figure the money.
That's how I
Me
look at
too.
it, because you see all these gaps and
Mhm.
funding doesn't fix everything, like we talked about workforce. But again, it goes back to Stacy's point. People have to want to go to treatment. You can't make them go to treatment, but you at least need to say, Connie, these are your 5 options for treatment. Here you
Right?
go.
So
You know?
again, what are those 5 options?
Yeah.
Well, I
This group
mean,
doesn't even know.
I could tell you.
Well, I think that's
in-
the
I think
goal of
that's
having
tomorrow,
a
I can tell you.
subcommittee that
I have a
addresses
story.
the treatment issue, right?
Because
I
they're
mean, like,
different.
we don't have all the answers. That's why
Okay.
identifying what we're interested in and then getting those subcommittees together to kind of figure
Okay.
out what exactly, but it does look different for everyone,
It
right? Like
does.
maybe they go to the ER first, maybe they're a juvenile, and then where do they go? Because they're not gonna
And
go
where
to
do they
some of
go
the
home?
treatment options that are available in the county because they don't address juvenile drug use.
Yeah.
So, like what,
they don't meet criteria for this for inpatient treatment. They have to be outpatient. Well, they're gonna fail if they're in outpatient because they're gonna go back home to the same people that got them to treatment in the first place.
That's a big.
So it's a huge convoluted mess, to be honest.
But I
And
could put together a master
Yeah.
list if you
Well,
want to
there's-
see
there's
some
the-
providers.
well,
that options and a little bit of
We'll
data.
let you guys work on that now that I understand what you're
Right.
thinking
Yeah.
there. So
It's-
that helps me.
I mean, mental health and substance use have been
Hand in
issues,
hand.
even though they're physical and mental health issues that we need healthcare for, it's a disconnect from traditional physical healthcare. We've known that since the 90s. So, I mean, when we had an inpatient psych department, we had an addiction specialist, psychiatrist, I could rattle off all stuff from the 90s, and none of those things are here now.
Okay,
No, 1990, Susie, to clarify.
so does
Not even
anybody else,
290s.
we've got Narcan, education and treatment.
Feels like
we've
it.
got hospital and Deb as the point people who are gonna work on that. And then the parent provider training, I don't know who wants to head that up. Anyone?
That's what Ken and I are
They're doing
doing.
education.
Oh, okay.
It's all inclusive. It's
Okay.
all
And August.
inclusive.
And then
Yeah.
education in schools with
Yeah.
Augustine.
So we're trying to cover
I'll
kind
do
of all the
treatment.
education stuff.
Okay.
I will
That's good.
too.
Okay.
So do you work with
Education.
Jay?
No, I'm gonna
Okay,
do
I mean,
treatment
he
with
usually jumps on the
Elizabeth.
ACT meeting.
Augustine.
And that's the second Monday of each month. And it's just, everybody's invited, hop on the Zoom, tell us what you're doing, what services are available. It's not like an action committee, it's more of a community update, service update meeting. Elizabeth chairs it, I'm the de facto chair when she can't attend. It just defaults, it's okay. So just so you know, Alicia's been joining us as well.
Try to delegate authority
Yeah.
as much as possible.
Do your groups, okay. In the interest of time, let's set our next big group meeting and then maybe the groups can bring back a report. at the
Individual
next
groups.
meeting.
Yeah.
Do you want to wait 2 months or do you want to meet sooner?
For this group,
Yes.
I think we need to meet in June and skip July because just a lot of people go on vacation in July, plus Ragbri's coming. So a lot of people are going to be involved in doing a lot of stuff with that. That's my opinion, but do
Every
with what
2
you want.
months for this bigger
That's
group
what
and then
we
we can
thought,
have
yeah.
some sub.
So it would
subgroups.
be June 18th. Does this work? Okay, 8:30?
Mm-hmm.
Okay.
That's just my suggestion, skip July.
Appreciate everybody's attendance and great ideas.
June 18th is, what is that?
It's a Tuesday.
It's a
Yeah,
Tuesday,
okay. Third Tuesday at
8:30.
8:30. PRD.
Yeah.
I feel like we heard of cats today. Right? We got some areas of focus.
Yes.
Definitely.
That's a good thing.
It's
While we're
progress.
all writing this down, can I just say something really quick?
Yes.
We're looking for specific treatment centers. If you go to Your Life Iowa and go to the resource finder, You put in the zip code and how many miles you want to search out. And then from there, it lets you filter it to alcohol and drug treatment, MAT, drinking, like DUI classes, mental health, blah, blah, blah. If you are looking for outpatient for an adult or youth, residential for an adult or youth, you can select their gender also, since there's different programs, and it will come up with the location, the phone number, how many miles it is away from you, all of that. And since they revamped the website, it has been really well up to date, which is something that used to be an issue.
Okay, thank you.
Right, Steve?
All right, anything else for today?
I do have one thing. So do you need to come up with a form for, like, if we want funds for something?
We need to have some kind of application form, and I don't have anything drafted yet. I don't know.
I'm looking at Elizabeth. Do you have something that would work? So if somebody on this group wants to bring forward a speaker or to expend money
For
to
call
apply.
cop, especially if we want to
Right.
get on that waiting list. and
Whoever's
then
doing that needs to go ahead and.
Just call them and then we can maybe approve it.
What?
Get the information to you.
Yeah, deposit slip,
Is there anybody else on the provider, rehab side of the group?
Parent provider training.
No, not that one. That's education and I'm already there, but I'm also on the other group, which is,
We've got education in schools, parent and provider training,
Which is
and
the same.
treatment options. Are
treatment
they the same?
options.
Okay.
Who's on the treatment? Is anyone else on the
Augustine,
treatment?
Me, Sandy, Chris.
Okay, I just wanted to know who to, are we gonna do little email
And
groups or
I
something?
can send out an email to everybody
Okay, that'd be
about meeting up and maybe some.
Okay, I gotta say, I wanna close the loop on this. Does this group wanna get tall cop or no?
Yes,
It sounds like.
Yes.
yes.
Okay, so is somebody gonna move forward with scheduling?
They are.
Deb's going to
Deb
get us
is-
the information.
Deb's gonna get the information together.
And get it.
Deb's giving the information to you. All right.
I can come up with some
Somebody
kind of
needs to do it.
application.
You just go ahead and do
maybe- Maybe,
We'll work on that.
yeah. okay.
So rather,
I'll
we're not
reach
gonna,
out to ISAC, see if they've
in
got
terms of
these.
procedure for the tall cop, we're not gonna wait till June to approve it in this meeting.
You gotta have a
We're saying-
deposit, probably,
Right, so
so.
we're saying that we should proceed with it.
Yeah, call and figure out what you need. We'll get an application together. So if you do need some upfront funding, then that will have to be approved by the board, but we can get that maybe going before Monday's meeting if necessary.
Yeah, that's
So
a
you
good
don't
idea
need
to
to
do
do
some kind of.
anything,
Is this for him to
request.
present to parent group, a group of parents or for
Parents,
kids?
parents,
Okay.
parents
Yeah,
and or
community.
And
providers.
community, we'll see what the options are, because I think he has a lot of different, because if we're paying that, I
He
know
does.
he will
He's
come
got
and do
different
several
programs.
presentations.
If he's in town.
So we need to keep him busy, different groups.
Right. Good.
Right. Right, you're right.
And ask him if he'll live stream something, because that came up too.
I don't think he does. I don't
Okay.
think he does.
I mean,
Right.
besides Fairfield schools, we have the MIU school, we have
Pekin.
Cardinal
And
and Pekin that have Jefferson County kids. I mean, they're,
Yeah,
I mean, so we could, there's more than one school.
I guess my only concern is just based on what you guys have identified as his primary speaking points, that she's getting together in a group of, in a room with a bunch of kids and he's saying, look what you can find at the drugstore, guys, and not to say that that would
They
inspire.
already know. They
They
already
already
know.
know, they already know, but I just don't know if he tailored to this.
I'm sure he does. He's got kids too.
So
Yeah,
it's-
he does.
You just want his contact. All you have to do is Google tall cop says stop. And
Yeah,
they'll
but
be,
she, I thought Deb had some other information.
well, it's just the cost, but it could be different. So I would tell you,
Okay.
you just Google him if you want him.
And then
So,
you can email him directly. He
Yeah.
answered me.
see, they have different classes.
and
I
think,
mean,
think carefully and we'll take the
It's right
input,
there.
since we're school focused, and
It's
also
all right there.
community. Think of the calendar and what
Do you
time
need
of
to put
year
these
is
in
the
there?
best.
And how do you
No, I
get
have no
the
idea whether they're
parents to
outdated
sign
or
off
not.
and
I just
approve
thought this
it?
was the
Because
legal
only the
workhouse.
kids, whose parents have agreed to
I
it,
would-
can go to it.
All right.
Yeah.
So that needs to be part
I
of
don't know
that.
if you find that useful, but I printed that out regarding evidence-based treatment.
Awesome.
Schools.
I'm into
Thanks,
that.
Cassidy.
All right,
Thanks.
Thanks, everyone.
guys, bye-bye.
Big button on the back of my shirt was big in my.
Oh.
If you want to
Good to
write
see
that,
ya.
can I?
I don't
Actually,
want
I
to
ended up
be
having
the
my
bearer
phone
of
with
bad
me.